20 odd stone, size, God, what, 26. Couldn't walk hardly, was out of breath, couldn't sleep, couldn't get anything to fit me, had sleep apnea, life was crap really.
I was 21 stone and my weight was just getting bigger and bigger, and even doing simple little tasks was such an effort. So we decided to do something about it.
I've been overweight all my life, from being 4, 5-year-old. I look back at the photos and really that's when I started putting on weight. I've tried every diet, every safe diet, every unsafe diet. I've tried the starvation diet and nothing ever really worked. But then actually last year we went away for our summer holidays, we went to Italy. And one of the things I always wanted to do in Italy was go to Pompeii and Vesuvius. And when I got to Vesuvius, I couldn't actually get to the top of Vesuvius. I couldn't breathe properly. And I think it was at that point that I thought to myself, I've actually got to do something about this, something probably drastic. And I came home and that's when I first contacted the doctor and said that really I was wanting to take perhaps a more drastic step than a diet. And he put us in touch with the bariatric clinic here at Darlington.
When we get the referral from the GP, we check if all these things, tried all the conservative measurements first, and if they fulfill the NICE guideline criteria, we invite the patient for a pre-operative patient information seminar, which is actually an informal meeting between the patient group and the bariatric team.
They do a big presentation and then you go and get weighed, and then after that I think they give you 3 months now to see how much weight you've got to lose. I think it's something like 5 kilos, it's about a stone, so you've got to lose that. If you don't lose it they wouldn't even look at you. Then you go and see one of the dietitians, and then from the dietitian you would then get an appointment to see Mr. Smear and Cheryl.
I'll meet and greet them at the seminar. At the seminar I'll do the weight, the height and work out the BMI for them, and then they'll go and wait for Mr. Samir and our dietitian to do a presentation which will give them all the information that they need about the service that we offer.
This is very important step, and I think very important step in the whole pathway, so that patient can understand that it is not an easy journey and there's many commitment he need to be done before we go ahead to operation.
From that day they'll have a point of contact, a telephone number for me which they can ring at any time if they have any questions or any problems. From that seminar they go away home with a weight loss target, which is usually 10% of their excess body weight. So they've got the 3 months to lose that excess weight. That gives them the time to decide whether bariatric surgery is right for them, and also to make some more enquiries or gather some more thoughts together with regards to what procedure they think might be best for them as well.
The questionnaire that the patients complete at the seminar is important to help us plan their care beyond that stage. Some patients may have a condition called sleep apnea, which affects their ability to breathe around about the time of surgery, and it's important they have special tests to either confirm or eliminate that condition so it can be treated to reduce their chances of complications after surgery. Other patients may need to see our specialist psychologist, which we'll arrange based on that questionnaire. Smoking is a cause of significant complications after bariatric surgery, and we ask all patients to stop smoking before surgery, and we can give them access to help from our smoking cessation service to do that. Cooking classes and health trainers are important to give patients that support that they need to make the lifestyle and dietary changes before and then to cope with life after bariatric surgery.
Patients are given an appointment to meet the surgeon, meet the specialist nurse and meet the dietitian as well. And the weight is measured at that stage. The surgery does involve significant lifestyle changes, and those changes do require commitment. The patient needs to also understand they need to make significant life changes, and need to show determination and a certain amount of drive to lose weight following the surgery by adhering to a diet and modifying the lifestyle obviously as well.
You need to be prepared physically, which is mean losing target weight, changing your lifestyle, and mentally also. It is not like cancer surface. You have that cancer diagnosed today and you do it well after a few days. It is changing the anatomy of the patient, changing the dietary habit, which is inherit already 30, 40 years have the same habit. So it's impossible to go ahead immediately for operation. So it is prepare the patient mentally, physically, changing that diet habit, making lifestyle like sport, changing lifestyle like sport as part of the daily habit. It is not a quick fix that you get the operation, lose weight, that's it. No, it is a commitment of the whole team, patient and the team.
Suddenly we had this whole different perspective on it, like the nurse Cheryl and everything, which is fantastic. Just made you feel much more comfortable. Anything you needed, it was there for you. Any questions you had, they'd answer them. Much more comfortable once I was in the bariatric hands.
My advice is to anybody, you've got to have that support beforehand. You know, don't be embarrassed or ashamed that you're having the surgery, because, you know, when people actually find out, they were like, oh, good on you.
Generally, the bariatric surgery based on two mechanisms: restriction or malabsorption. Restriction does mean the patient will not have the capacity to eat a proper meal or large meal size. Malabsorption means decrease the amount of the calorie which we absorb by the bowel. So the band, gastric band, which is a silicone band, we put it at the junction between the esophagus and the gullet and the stomach, which make the entrance to the stomach a bit difficult, which increase the peristalsis, the contraction of the gullet when you try to push the food through the band, which gives signal to the brain, and then patients stop eating. The other type of restriction is the sleeve gastrectomy, which is taking about 3/4 of the stomach, decrease the capacity of the stomach. Normally is about 1 liter, we decrease the capacity of the stomach to about 50 ml. So again, there will be no much room to eat a very big meal, which gives the patient a quick satiety feeling. The third type of operation what we do here is the gastric bypass, which can give us the both mechanism. The restriction, as we make small pouch, again capacity about 50 ml, and we do the bypass, which give us the malabsorption effect. Beside these three types of operation, I maybe forget to mention that people with very high body mass index, above 60, it is too risky to go immediately for a surgery. So what we do, we put an intragastric balloon. So it's a silicone balloon, we insert it endoscopically by camera and put it in the stomach, and we put between 500 to 700 ml, helping those patients with very high body mass index to lose weight before the operation, which reduce dramatically the risk of the anesthesia and the risk of the surgery. And we had here very good result. The patient managed to lose up to 42 kilograms in 6 months before the operation. So we discuss all these type of operations, the pros and cons of every type of operation, and then we make together, the surgeon and the patient, the proper decision.
Yeah, patients are put on what's called the liver reducing diet, which is basically a diet that shrinks the liver. And the way that it does that is that it reduces the amount of fat intake by the patient, and this then makes the surgery easier, because the liver can cover the stomach and make it very difficult to perform the surgery. And it may be, if the liver's too big, that we can't perform the surgery at all. So it's incredibly important that patients have to stick to this diet.
More and more reports are coming out saying that obesity surgery can actually cure diabetes. 9 out of 10 people who have bypass surgery, they have what is called a 5-year remission rate. The moment they have surgery, even before they lose weight, we notice that they do not need to be on any diabetes medication. So that is something that we have to keep a close watch on.
Patients will come in on the day of surgery, so the patients don't come in the day before, so they're worrying at home on the night.
We had to be at hospital for 7:30 upon the ward. My husband came with us.
And they'll arrive on ward 32 here at Dartmouth Memorial Hospital, where we do have a designated bariatric unit.
I went down for my operation at 8 o'clock. So it was really quick, so it wasn't really much time to sit and start worrying too much. They walked us through everything, told me what was happening that day. They introduced me to a nurse who would be looking after me specifically through that day.
They'll be seen by myself, the anaesthetist, and Mr. Samir, or one of the consultants that morning. Mr.
Samir, obviously, I went in and he come up in his gown to see us, and he was going, "Oh, come on, we'll get you walk down," and that. It was just as though he was taking us for a cup of coffee.
And that puts you at ease straight away when the surgeon can take time out
will come up,
and come up and spoke to you. You think, wow.
My named nurse stayed with us until I went under the anaesthetic, and then when I came to, obviously I was back in the room with the named nurse. She was there with us again. So I felt as though, you know, she looked after us the whole time.
It's perfectly natural for people to worry about coming into hospital on the day.
My biggest thing was the anaesthetic, but the actual operation, I was up the next day. I'm like a manager, so I work like 45, 50 hours a week. I was off work for about 12 days. On the Thursday, I was still in hospital, and they were saying to us, "You're not pressing your morphine." I was like, "Oh, I keep forgetting about it. Didn't even need it." Come out of hospital with all these painkillers and that. Never took a painkiller. The following week off work, then I went back to work 45 hours.
As soon as the patient comes back from theatre, the follow-up starts then. They'll drink water as soon as they return to the ward and progress to a soft diet over the first day or two before discharge. It's important that the patients mobilise early to prevent clots in the legs, and we take other steps such as medication and also stockings to prevent that. It's also important that patients mobilise early and are able to breathe to avoid problems like chest infections. All our patients require to take vitamin and mineral supplementation after bariatric surgery in terms of tablets, and also some patients will require 3 monthly vitamin injections. All these medications and injections can be provided by the patient's GP surgery. Also, for the first month after surgery, patients find it difficult to swallow big tablets, and therefore they'll need to either get medication preparations that are crushed or liquid medications for that first month.
We'll see them at 6 weeks, 3 months, 6 months, a year, and then a year. So their overall follow-up will be for 2 years. At that point, we'll discharge them back to the GP, and where they'll have to have their bloods rechecked at least annually.
We've got a bike now, a treadmill.
Join the gym.
We spend absolute fortune on clothes. I've gone like from a 26 to a sort of about, well, I'm just going into a 12 now. So totally different.
What we offer in Darlington and Durham is a team approach. So they will always have a physician. It's not the surgeon who's going to be doing it on his own. He has a team of clinicians working with him, and we'll be with them from the beginning and for a long time after surgery, and as long as this is necessary.
I started at size 28 dresses. I'm now wearing size 22. I've lost a fraction under 6 stone. I am losing about 1 to 1.5 kilograms every week. And I know, you know, lots of people say that you have a gastric operation of some sort and it's kind of like cheating. You know, it absolutely isn't, because you still got to diet, you still got to eat the right things. But I think what inspired me was, once I'd had the operation, I actually knew that by changing what I was eating and changing what I did, it was going to change me, and it has. You know, I've never been able to lose 6 stone before and keep it off, and I'm still losing weight now. So that kind of gives you the power and the energy to continue with what you're doing.
It's life-changing for the patients. When they've lost the weight, they're feeling healthier, they're feeling a lot more energetic. They'll often say to me, "I feel as though I've got my life back." That's the patient's words and not mine. And it's just lovely to get the positive feedback that we get from them.
Because now I can run for 10 minutes on the treadmill at like a high speed. You don't get fitter. Like Deborah there, she would never ever walk anywhere. And you would never go out to walk with the dog, would you?
No, I went to Amnesty Forest the other day, so we'd go on the bikes. I'd had a stressful day at work, so normally we'd come in and go for takeaway, and we'll like put the bikes in the car. We went to Amnesty and we went for about a 4-mile bike ride.
Certainly I've heard many patients say that they've been very grateful and they have developed a new lease of life But I think overall, though, it improves their social functioning and improves their general happiness and their self-confidence as well.
And we have got a holiday this year. In fact, I'm going away on Friday and we're going to Mexico. And I have been told that Chichen Itza has got 90 very large steps, so I am going to try it out this year and see if I can make those 90 steps, and I'm fairly sure I can. But I think maybe Italy next year, Vesuvius, I will crack it.